Do you remember when you were a little kid and you would get in trouble? Do you remember how your parents punished you? All different, probably. Mine always sent me to the timeout step on the stairs. And after sitting in silence at that point, I learned my lesson. I was not going to hit my brother ever again. Now, given this year's theme on lessons we've learned from COVID-19, I've been thinking a lot about the kinds of lessons we learn, and how we learn them, and why we learn them. Learning requires realization and change. You have to sit on that step and think. And there are easy ways and hard ways of learning. Now, I've thought about what lessons we may have learned. Maybe that human social interaction is important, or that digital media gives us an opportunity to connect with others, or that essential workers really are essential. But even trying to research all of these topics, desperately in search of my thesis for this year's talk, I couldn't find an answer. I realized that unfortunately, but truthfully, we haven't learned anything. As individuals, maybe, but as a collective, especially one with structured hierarchies, such as a campus administration, we haven't learned anything from the pandemic. Out of the many lessons we could have learned, we haven't really learned one. So taking Hamilton as a case study, let's look. We haven't learned that healthcare should be this major priority. We've ignored lessons on structural inequality and systemic oppression. And we also have most certainly learned nothing at all about preparing for global catastrophic events. I'll start by talking about healthcare. In terms of actual infrastructure, there are massive staffing issues brought on by decades-long mistreatment and mismanagement, and these have drastically affected rural regions. A McKinsey survey reported that last year alone, 500,000 nurses left the bedside, a majority citing reason being as staffing issues. We see these issues here, too. Our urgent cares, for instance, have pivoted to solely COVID-focused things, meaning if you've broken your arm, you'll have to go to the ER, which already has slow times. Even on campus, health center appointments have been hard to get, and last year alone, non-COVID-related things were only handled in the morning, meaning if you had an issue in the afternoon, you either had to wait or go off campus. And the healthcare infrastructure outside of our hospital systems has faltered, too. While vaccines were in short supply early in the pandemic, I think we all would have expected an abundance of vaccines by the time we needed booster doses. Hamilton actually did a great job organizing clinics last year, but this past semester, when booster doses were finally available, there were no on-campus clinics, and despite that booster requirement for this semester. In fact, the only clinic that we hosted was in February this year after we already had a booster requirement, meaning that it wasn't enforced. The lack of tests and masks also impacted all of us, especially as we geared up to return to campus. While nationally we had major shortages, the health center also never sent us kits at home. They are this time for spring break, though, so maybe there's been a lesson learned there. So, it actually reminds me a little of when reporters asked Jen Psaki about sending tests home to the American people before the holiday surge, and she laughed. And now, the Biden administration has actually sent out those tests. There's a collapse of leadership across these systems, from campus communities up through the national organizations and government structures. Let's look at what we've learned about our society as well. Despite having a summer of protests and a push to dismantle systemic racism and oppression in this country in 2020, states have completely regressed to the point of book banning and voter suppression. The COVID-19 pandemic has highlighted the medical and structural racism that persists in our society. With COVID-19 specifically, the CDC found that Black, Latinx, and Indigenous Americans are at higher risk of hospitalization and death. On this campus, leadership is still struggling to address issues of inequality. The 2020 Advisory Council left out prominent Black scholars on campus. And just in the last few weeks, there's been a lot of discourse on systemic issues that faculty of color and LGBTQ faculty face on this campus. And most strikingly, the leadership's failure to address these issues and concerns. The pandemic has revealed the oppressive features of society, and yet there is that collapse across all systems, from school to country, as people in those positions of power struggle to do anything and don't internalize those lessons. The COVID pandemic is not the only major cataclysmic event we will ever face either. If we can't get our hands on COVID, how can we handle climate change? Hamilton is still not divested, for instance, even as many of our peer institutions do. We have the luxury of putting that off, but not with COVID. We actually have to face COVID from the nose up. You're all wearing masks. But even with masking, even though it's in this room, we see COVID on our dashboard in our Grubhub budget or in our hotel room capacity. But with the recent changes to masking, there's been scattered policy implementation. There's some guidance, but there's also little advice on parameters to set. I have professors asking classes whether or not they think it's okay to mask or not. There's little to know. If you walk into KJ, in some parts students are wearing masks and in others they're not. It's a free-for-all. And it's not just Hamilton alone. We see this in schools in Virginia and in New York. I used to believe that so long as an issue was directly in our faces, we would address it, and that climate change just wasn't a big enough issue for folks to pay attention to yet. But COVID is here. It's in our faces. It's on them. And yet, it's scattered. It's a weak response. So even with an issue that is monumental, we do nothing. We have learned no lessons from COVID-19. Learning requires thinking, commitment, and we are learning the hard way. We are all on the timeout step right now, and yet we are not thinking hard enough about the issues that we need to tackle, healthcare, inequality, and long-term issues that we face in the future. We are not actualizing. Instead, we are biding time, waiting to get off the step, waiting for a return to normal. These are lessons ignored. And if we do not learn them, and we do not internalize them, then we will end up on this same step again. Thank you.